Welcome back. Now it's time to get a look at some health headlines on MedWatch today. The American Academy of Pediatrics recommends all children receive their flu vaccinations as soon as possible. In 2016 to 2017, over 100 U.S. children died of the flu, and several thousands more were hospitalized for complications from the flu. Research shows about 80% of kids who die from the flu are not vaccinated. Pediatricians say it takes up to 2 weeks for the shot to protect against the virus, so it's important to get vaccinated now before the season gets underway on November 15th, according to the Fresno County Health Department. It's hard to predict how hard the flu will hit this year, but medical experts say there are signs we could be in for a tough season. And high blood pressure is a major risk factor for heart attack and stroke. But new research shows many adults with hypertension aren't keeping their pressure at a healthy level. According to a new CDC report, about 30% of Americans have high blood pressure. Medical experts say poor diet and lack of exercise are often reasons why patients can't keep their blood pressure in check. The report also reveals hypertension is most prevalent among African American men and African American and Hispanic women. And some health officials are making a push for the only vaccine that drastically decreases your chances of getting cancer, the HPV vaccine. Experts say the vaccine reduces the risk of cancers in the throat, cervix, and rectum. The sexually transmitted disease, HPV, is directly linked to cervical cancer. The vaccine is recommended for both girls and boys between the ages of 11 and 13. Part of what makes community medical centers so special is the staff. And that's why every week we feature a healthcare hero. Our Julie Musgrave introduces us to this week's hero, an employee who always puts the patient first.
That's where Lynn Kuramaji comes in. She's a clinical laboratory scientist at Community Regional, and not just any lab scientist, she's Laboratorian of the Year. Her co-workers describe her as being courteous, cooperative, and takes on tasks not required of her. Kuramaji takes samples and runs tests on them to confirm or bring up other issues that might assist a doctor in his diagnosis or treatment process.
It makes you feel like you're in the room with the patient, that you're helping not only the patient, but you're helping the family, to kind of come together and at least you know what's wrong. You know that it's treatable, hopefully.
She's been doing this for 15 years and is known on the team as someone with sound judgment across the board and always stays motivated.
If you'd like to join the team at community medical centers, take a look at our Job of the Week. Community Medical Centers currently has opportunities available for registered nurses. Candidates must be a graduate of an approved nursing program, have their current RN license for the state of California, along with a current BLS and ACLS certification. Just visit jobs.communitymedical.org and search registered nurse to review open positions and apply. Coming up on MedWatch today. Achieving your dreams with hard work and hardworking doctors. Meet a recent Fresno State graduate who suffers from cystic fibrosis. How she was able to beat the odds, we'll tell you next.
Hi, I'm Dr. Ken Bird. I'm the health officer for Fresno County. Please protect yourself, your loved ones, and your community by vaccinating against the flu. Thank you.